You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker, owner and founder of Good Life Family Chiropractic here on the south side of Lincoln. And we're coming to you today with another episode of Health, Hope, and Wholeness. And I wanted to talk to you today about a question that I get fairly often, and one that I got again just the other day. And it was this: Dr. Jake, have you ever seen a perfect spine? And the answer is yes. But have I ever seen a new and perfect spine from a new patient? And the answer is absolutely not. I just don't think that they exist currently. Right now, with the way that we neglect our spines as a culture, as a healthcare system, we don't even get taught proper spinal care, proper posture in our current healthcare system. And so the idea that someone could have a perfect spine while completely neglecting it their whole lives makes no sense at all to me. In fact, our system right now, and I had a gentleman that came through just yesterday with this a perfect example. He came into the office after hearing the radio show and wanted to know if there was something that I could do that would keep him from having surgery. And he told me a little bit about of his history and how about 25 years ago, almost 30 years ago, he had a problem, sciatica, where he had gone to what he called a or a ligament specialist doctor who kind of did an exam and then decided that they needed to do an injection, that they give him a steroid injection. And so part of the problem right now is they won't give him the steroid injection because steroids inherently suppress the immune system. And right now, nobody wants a suppressed immune system. And so they wanted to do surgery on him, though. And so he was coming in here for a second opinion, trying to figure out if there was something he could do to keep from having this surgery, having this medical intervention that would be dramatic and take a lot of time, a lot of money, and a lot of his resources. And I took a look at some of the resources that he brought along with him. He had actually had an MRI done, and what we could see on the MRI was that one of his discs had herniated and looked like it was actually prolapsing into the nerve root. And so, I mean, pretty severe case. But he thought coming in that he just slept wrong, or he lifted something wrong, or just done one thing one time that created this issue. And that's not how these things work. You can't bend over, pick up a sock, and a good back go into a bad back. It has to happen progressively over time. It's called Wolff's Law. If you have a normal, healthy spine, your spine doesn't degenerate, it doesn't get osteoarthritis, and you don't get herniated discs. But when you move the spine out of alignment, even 2 millimeters or 2 degrees, it's enough to restrict the amount of flow through the central nervous system, keeping your body from expressing health and allowing that disease to build up, whether that's arthritis or herniated discs. That's how that happens, is when it's out of alignment. That's how Wolff's Law initiates. It degenerates at a rate of 7% per year. And so I looked at his x-ray and we saw the exact cause of why that disc had herniated. We saw that because he had developed a scoliosis, and not just recently, this scoliosis had been developing for the last 25 to 50 years, depending on what the initial trauma was. And he didn't remember a trauma. He said he's been healthy his whole life. He felt fine until about 25 years ago. All of a sudden, out of nowhere, he started getting sciatica. And they gave him an injection. They gave him corticosteroids, and he felt fine for the last 25 years. But now he's got a severe herniated disc where I have to tell him, look, I'm not going to be able to force that disc back in there. I might be able to redistribute the pressure on the disc so that it takes pressure off of the nerve root. But ultimately, God's the one who decides how this heals. We can restore the proper biomechanics. We can work with God's rules and principles of health and healing, all that we want, but there comes a point of no return. Eventually, right at the end of our lives, God calls us home. Eventually, if you allow sickness and disease, something like diabetes, to grow inside your body for long enough, it will kill cells, tissues, and organs inside your body irreparably. Can God breathe life back into a dead body? Absolutely. Will he choose to violate his laws and principles that you've willingly chose to violate your entire life to get you to the point where you're at? Usually not. Usually not. And while I pray for every single one of my patients to heal, and I believe strongly that that prayer works, Ultimately, it's up to you as the patient as to how healthy you're going to be. If you're dealing with neck pain, if you're dealing with back pain, if you're dealing with headaches, the same question that Jesus asked the paralytic at the pool of Bethesda, do you want to be well? Is the question I ask you today. If you want to be well, then pick up the phone and call my office at 531-289-7100. And we're standing by to take your phone call and set you up for an initial consultation, evaluation, digital nerve scan, and if necessary, x-rays to see exactly what the cause of your problem is so that we can get you back to living the life that God created you for in the first place. If you're sick and tired of being sick and tired, if you're sick and tired of being stuck on your couch, you're stuck in your lazy boy, and you want to get up and want to have life again, let's get to the cause of your problem. Let's start working this backwards. And ultimately, when we start doing the things in reverse of what got you to where you are today, your body will start to heal. That's how God created you. He created us for health. He created us for eternity. Ultimately, when God created this world, he created us in the garden, in an environment where these physical forms could last for an eternity. But ultimately, we corrupted this form and this world by the choices that we made. And if we can work that backwards, no, you're not going to live forever in this body. God's going to call you home eventually, but we can make sure that you have the ultimate of what God has for you in this life, in this body, in this world right now. And John 10:10, Jesus said, I have come that you may have life and have it to the full. And he's not just talking about eternity. Yeah, that's where we step into the fullness of God, but you can experience that now. You can experience that today, and you can begin to experience that physically by following his laws and principles, by looking at the cause of your problems, looking at your spine as a protector and part of that neurospinal unit that actually controls expression of health and life and function and nutrition, and looking at how what we put into our bodies either builds sickness and disease or actually actively builds health. We can look at the toxins that we surround ourselves with. We can look at the amount of oxygen that we take in, whether through exercise or lack thereof. And we look at the stress that we put ourselves in. And these are the things that create patterns of sickness and disease, or health and life and vitality. And that's what I want for you, is health and life and vitality, a fullness of life. So if you're ready for that, if you're ready to step into that, pick up the phone and call or text our office, 531-289-7100. You can also go to goodlifefamilychiropractic.com for more resources for how to get healthy right now. But yeah, I mean, this really, and if you're following along on Facebook right now, I've got a video live stream up of us recording this. I have an x-ray off to my side here. And this is one of my favorite patients. In fact, she's the daughter of my current office manager, but I did not see Haley as a patient the first time while my office manager was working here. In fact, she was coming in for her husband who had herniated a disc in his low back, and was learning about all of this stuff and how to read x-rays and how to see what's going on. And one of the things that we covered was scoliosis. And scoliosis is one of those things that affects about 5% of Americans before the age of 20. But after the age of 20, it starts building and progressing upward. And by the age of 80, over 80% of Americans have a scoliosis. Now, that's like saying that over 2/3 of Americans have diabetes or pre-diabetes by the age of 80, because that's also true. But it's even worse, because having scoliosis is like having type 2 diabetes, in that it does decrease your life expectancy by between 14 and 20 years. Just by having it in your body. And that's any curvature. That's not even a severe curvature. That's any curvature of 10 degrees or more when you're looking at this from the front. So when we look at this, and you can on Facebook, remember facebook.com/Ask Dr. Jake if you want to follow along in video form, or go back and listen, or point your friends and family to this. But you can see here that Haley has developed a grade 1, or at least borderline grade 1 scoliosis in her low back. Now, unlike most people that approach chiropractic, she was not dealing with back pain or neck pain or headaches, although those are common things that we see when people have a scoliosis. It puts so much pressure and tension on the spinal cord and nerve roots that it literally starts to affect the function of the organs on the other end, the cells, tissues, and organs. And so Haley had been dealing with issues where she felt like she needed to go to the bathroom all the time. And her mom said, hey, can this help with that? She didn't know she had a scoliosis until I did that exam and decided that we needed to take these x-rays. We got that x-ray, we saw that scoliosis, and we said, well, let's do an adjustment. Let's see how she responds. And the first day I did an adjustment was the first day that she didn't feel like she had to go to the bathroom constantly. And within 2 months, her spine had completely changed to the point where she didn't have that sensation at all anymore. In fact, you can see on the next x-ray here that the scoliosis was gone completely. And that's the kind of change that we make here in this office. But that's even more importantly, the change that we can make in children. Scoliosis doesn't start when you're 80. Scoliosis doesn't start when you're 60. Scoliosis doesn't start when you're 30. Scoliosis starts in childhood, even if you don't develop it until late adulthood. It's the misalignments, it's the restrictions, what we call subluxations in the spine, where there is a misalignment that changes the biomechanics of the joint, and in doing so changes the neurology of the spine and of the brain, and it starts degenerating over time. And it turns into a scoliosis, and the scoliosis turns into a scoliosis with arthritis, and that arthritis and that scoliosis end up creating bulging and herniated discs. And those misalignments, those things that bring us out of alignment with God's laws and principles of health and healing, ultimately create dysfunction. But where she got the correction and she got the healing, you can too. And we've done this same thing with 80-year-olds, mind you, not as fast. We've done the same thing with 90-year-olds. I don't care how old you are. We've seen it begin to heal. If God's still putting life and breath and vitality in your body and you want to be well, remember, that's the key thing today. If you want to be well, you can. You can. How much is determined by how much you've been through and how willing you are to reverse those things that you've done wrong and start putting yourself back on the things that you can do right. And everybody can do something right today. And I'd start with picking up that phone and calling the office at 531-289-7100. And we'll be happy to set you up with a consultation, exam, any necessary x-rays. First 5 callers today will get all of that for just $65. That's a 50% discount off of our normal exam and x-ray fee. So again, 531-289-7100. Make sure you let us know that you are listening to us on radio, on the Ask Dr. Jake show, so that we can give you that discount to get today. We are on the south side of Lincoln. We're at the corner of 56th and Pine Lake, here next to Campbell's Nursery, facing Pine Lake, between Mindy's Nails and Deep Sky Wealth. The initial exam is just one of the first 3 visits where we will go through the process of figuring out exactly what the best course of care for you is. We'll start with that exam, any necessary x-rays, and then from there, I'll analyze those, send you home, bring you back either the same day or the next day. We'll go through those together and see how you respond to an adjustment. From there, we'll bring you and your spouse back and go through the plan for care to getting you well. I'm Dr. Jake. I hope to see you again tomorrow for another episode.